Hello and welcome back. I thought I'd talk to you briefly about anxiety because anxiety is a term that we hear a great deal of, especially in this busy day and age. And anxiety is something that is really kind of natural and normal to everyone. And in fact, it's a survival mechanism. And it's very important that we do feel anxious under those circumstances where anxiety can help us survive or thrive. Unfortunately, sometimes anxiety gets the better of us, and it may or may not have its roots in reality, and it may not be able to shut off. So under those circumstances, we have what's called an anxiety disorder. So just to talk a little bit about the difference between ordinary anxiety and an anxiety disorder, we might want to use the illustration of the dark alley. So if you're walking down a dark alley and you see someone coming towards you, dressed in dark and their face is obscured and they're carrying a lead pipe and hitting it in their hand like this, you might begin to get anxiety over that, and you would probably have what's called fight or flight. And in general, anxiety is fight or flight, and it can be fight or flight for the good or fight or flight run amok. So if you see somebody like that in an alley, generally you're not going to stop to talk, you're going to run or you're going to fight, and those are appropriate responses, I think, in those circumstances. And that's how anxiety protects you. How anxiety doesn't protect you is if you're walking down a three-lane highway on a broad sidewalk and it's a tree-lined street, and there's no indication or hint that there's any generalized danger to you, but suddenly you're seized by thoughts that perhaps any of the people walking towards you could be that thug with the pipe, then perhaps you have an anxiety disorder, because your anxiety is kind of getting the better of you and running amok, even in a way that you may be aware of. It doesn't seem right, it doesn't seem normal that I'm anxious under these circumstances, but I am. So Robert Sapolsky says it beautifully in his book, Why Zebras Don't Get Ulcers. He says that zebras would laugh at us because in a herd, zebras graze on the savannah and everything is peaceful and wonderful, and then along comes a lion and chases the herd. And as the herd is running from them, they have huge fight or flight. Their blood pressure goes up, their heart rate increases, they sweat, they run, they go as fast as they can, they do all they can to survive, and then when the lion takes down one of the herd slows to a stop, and then everything returns to normal. With anxiety disorders, similar things happen in our everyday life, but things don't return to normal. So some of the anxiety disorders that can happen are just generalized anxiety disorder, where you have low-grade anxiety all the time, and you can't seem to name why. Another is panic. So panic might be where you literally panic over certain things like driving. It's a very common one. And you can't breathe and your heart beats fast and you feel like you're going to have a heart attack and you think you're going to pass out, and you're terrified because you're driving down the road and you've got to pull over, and it's a nightmare. And lots of people with panic disorder do believe they will die. They won't, but they believe that they will. And so the bad news about panic disorder is that it frequently begets panic. So you're panicking about the fact that you may panic, which makes for a nasty cycle. Another is phobias, where you're afraid of certain specific situations, like giving a speech in public, or perhaps snakes. OCD type behaviors, or the checking or the obsessive thoughts or compulsions, help mitigate your anxiety, but it may be anxiety that has no basis. In fact, like every doorknob is probably not going to give you some horrible disease, but people with OCD may see it that way and engage in a lot of cleansing or other types of checking behaviors. And then finally, PTSD is a classic anxiety disorder, and that usually has to do with where your life or your livelihood or your sense of self, your very sense of being, has been threatened in a profound and real way, in a traumatic way. And you know that enough time has passed that you're still reacting as if it was, going on in the moment. Any kind of trigger could make you just go right back to that and begin that fight or flight, or the just sort of deep fears that kind of have no basis in reality, but at the same time there's an explosion. So if you are dealing with any of those kinds of disorders, it's really great to get checked by a mental health professional who can help you make a proper diagnosis, because they can kind of overlap or mimic one another, and receive some treatment, because the good news is anxiety disorders are really very, very treatable. There's a lot of evidence-based practices, and there's some good medications too. So definitely give a mental health practitioner a call and see if it's a good fit and that you can begin the process of healing if anxiety is your issue. Well, thank you, and I look forward to seeing you again next time.